Okay, hi Dawn.
Hi, Grace.
So, we've been talking a lot about prenatal depression, and some of us are hearing about that for the first time. We've heard about postpartum depression, but we're hearing a little bit more about prenatal depression and something that's not really well known. Can you first maybe start us off with something that we know a little bit more about by summing up what postpartum depression is?
For sure, Grace. So, postpartum depression is when women experience depression symptoms after they've had their babies. It can happen anywhere between about 6 weeks to, a year afterwards. So, where some people think that, postpartum depression is something that you get right away or within the first 3 months and then it can't happen again. And so anything they experience after that isn't postpartum depression. That's not what we know about it at this point. So postpartum depression can have symptoms that look like any other kind of depression actually. So wanting to sleep more or less, eating more or less, the biggies, feeling angry, feeling irritable, feeling sad, loss of joy, and things that used to bring you joy. Those are really the biggies.
Mm.
So what happens though in the postpartum period is women sometimes don't understand whether this is normal for after having a baby or whether this is more than normal. And when women aren't sure about that question, they often don't check in with their doctor or with a nurse on it. So they aren't sure then with whether they're experiencing is true postpartum depression or just being tired, just having had a new baby, hormones, all of that.
So, what I'm hearing is a lot of symptoms can be missed under the radar.
That's exactly right, Grace. And mostly because women just aren't sure whether that's what they're struggling with or not. And I think, secondly, because most of our healthcare providers in North America, most obstetricians, family physicians, nurses, aren't really in the habit of asking women how they're doing in terms of their mood to understand. So women may not be asked the question. They're not sure whether they're struggling. And so there's a little bit of a cycle of physicians don't ask, women don't tell.
Okay. So, switching gears here a little bit, what are some of the signs of prenatal depression and anxiety?
Right. So prenatal depression looks a lot like postnatal depression. The key things again, being irritable, feeling angry, not experiencing joy in the things that used to bring you joy. Those would be the top things. Sometimes women do struggle again with eating more or less than usual or sleeping more or less. But again, those two things are kind of complicated in pregnancy, aren't they? When women are generally resting more than what they usually do and may feel like they need to be eating more. So those are really the symptoms of depression. Prenatal anxiety is it looks a little different. It's really having worry that just doesn't go away, being worried about things you might not normally be worried about, having a more excessive reaction to things, and then having worry that's quite long-standing, just not being able to bring your fears and worries under control.
Hmm. And am I correct in assuming that doctors in general may not know to regularly ask women about their emotional health in pregnancy as well?
That's true. So, uh, in some countries, physicians and nurses, obstetricians, midwives do ask the questions about emotional health in pregnancy. But in North America, we're just not at that stage. So if women are concerned, then it really is up to them to mention their concerns to their physician if their physician doesn't routinely ask.
Hmm. Okay. So, to help the women who are pregnant and wondering what the differences between prenatal depression and anxiety is, and what the difference is from from just having the blues,
Yeah, yeah.
how can you
So,
tell the difference?
yeah, good question, Grace. So the blues is more time limited, usually right after women give birth, so within the first week. So if symptoms continue beyond the first week, then that's kind of a flag that, maybe there's something more, but especially if it continues on beyond a couple of weeks. What does that look like? When women first have their baby, they're often tired. There are some hormonal shifts going on, and so the blues can play a part in that. But really, it's a weepiness. It's kind of teary and weepiness. It doesn't usually have the anger, the irritability, the loss of joy and things you used to do piece to it. So it's really kind of almost an uncontrollable weepiness. You just feel like crying at the drop of a hat. So what really distinguishes that from any other kind of depression is that it lasts more than 2 weeks. And again, there's that anger, irritability, loss of joy. That's a much, deeper sadness and depression than a baby blues.
Okay. Wow. So for women who are wondering what the next steps are with that, it's a lot to process. What would you recommend that they do?
Yeah. If they are concerned at all, make an appointment with their doctor, talk to their physician about it, especially their family doctor. And it doesn't hurt to go and have an appointment and to ask a question. It's a little bit of time, and that's all the risk that there is. So the biggest thing is, if women are concerned at all, to go ahead and make that appointment with their physician and have a conversation, or their nurse. The other thing, Grace, that we can offer for women as well to help them to understand the difference between blues and depression is we have a downloadable checklist on our website. The link is just below in the box. And that can be a resource that can help women to take just a very brief, kind of quick assessment of whether what they're experiencing is blues or a true depression that they may want to get checked, that they may want to check in with their physician about.
Okay, well, that's perfect. Thank you so much for sharing your knowledge and your time today, Dawn.
My pleasure, Grace.
Until next week.